Hello everyone, welcome to 5 Mark Short Note series. Today we will discuss about learning disability. Learning disability is a neurodevelopmental disorder in which a child with normal intelligence has difficulty in acquiring specific academic skills such as reading, writing, or arithmetic. It reflects in a difference in brain processing rather than any lack of intelligence or opportunity. Learning actually requires integration of visual, auditory, and memory centers in the brain. So the occipital temporal areas process the visual input, temporoparietal cortex decode the phonetics, and frontal lobes regulate attention and working memory. So dysfunction in these networks can lead to learning disability. So what is epidemiology? 5 to 15% of the school-aged children tends to have this learning disability. It is more common in boys than in girls and often underdiagnosed in India due to low awareness and stigma. What are all the types of learning disabilities? Dyslexia, that is difficulty in reading and spelling. Dysgraphia, difficulty in writing and organizing thoughts. Dyscalculia, that is difficulty in arithmetic and understanding numbers. Non-verbal learning disability, that is poor coordination and visuospatial issues. So what are the etiologies? It could be genetic, there is a familial inheritance of learning issues, or neurobiological, altered activation in left temporal and parietal regions, and in perinatal causes like prematurity, hypoxia, or any infections, environmental causes like poor stimulation, malnutrition, or ineffective teaching. So, coming to the pathophysiology. So, learning disability results from functional disconnection from brain regions responsible for the symbolic processing. So, in case of dyslexia, phonological processing deficits will be there. In case of dysgraphia, impaired fine motor and visual integration will be there. In case of dyscalculia, defective numerical sense and sequencing will be there. So there will be difficulty in reading, writing, or doing mathematics. Reversal of letters or skipping lines will be there. In behavioral issue, there will be frustration, anxiety, and low confidence. This usually occurs due to the stigma and poor awareness. And it tends to be associated with disorders like attention deficit hyperactive disorder, speech delay, or emotional problems. So, diagnosis. Clinical observation and teacher report forms the main basis, and psychological testing wherein IQ will be greater than 85, but there will be poor academic achievement. So there is a tool name called NIMHANS SLD Index and the Wechsler's Intelligence Scale, which can be used. And while making a diagnosis, we have to exclude any visual, hearing, or emotional disorders that are pre-existing. So what is the difference between learning disability and intellectual disability, which is previously called as mental retardation? So in learning disability, there will be difficulty in academic areas despite normal IQ, whereas in intellectual disability, there will be global delay in intellectual and adaptive functioning with low IQ. So the IQ level will be greater than or equal to 85, but it will be less than 70. There will be normal developmental milestones, but delayed milestones here. Only academic skills are compromised in learning difficulty, whereas here all the domains are compromised. Response to training improves markedly with remedial teaching. A limited improvement even with training. And the social skills are quite normal for age. These are impaired or dependent. There is an excellent prognosis with early intervention, but a lifelong limitation and variable dependence in case of mental retardation. So, coming to the management, early identification and screening is important. Remedial teaching like phonetics, multisensory teaching are required. Behavioral therapy and positive reinforcement is required. Parental counseling to avoid punishment for poor academic performance is very essential. School should be facilitated to accommodate them by providing extra time or doing oral test. Pharmacotherapy for comorbid conditions ADHD, if present, only then pharmacotherapy is indicated. So the prognosis is excellent with early diagnosis and tailored teaching, but untreated cases risk for being a school dropout with anxiety or depression. However, you can see many celebrities, including famous cricketers and actors, excels and despite having such learning difficulty, so they tend to excel in creative or analytical fields once they are supported. So coming to the take-home essay, to summarize, learning difficulty is not due to low intelligence. It reflects a difference in how the brain processes information. Early intervention, empathy, and individualized education fully protect the potential of the child. A child with learning difficulty is not slow; they just learn difficulty. Sorry, they just learn differently. So I hope you have learned from this lecture. Thank you.